Today we're going to talk about feedback loops in diabetes. In previous years, I've just kind of drawn these notes up on the board, but this year I decided to make this PowerPoint for you guys to see, and I've also loaded it up under modules, so you'll be able to follow along. There's basically two types of feedback loops, and the first thing I would say is that their names are really misleading, and so you probably will get the wrong idea about what the feedback loop is when you first look at their name. The first feedback loop is called a negative feedback loop. And when you see negative, you probably think bad. You're probably thinking this is something bad. And that's not the case. Negative feedback loops are called negative feedback loops because they reverse or reduce whichever direction it's going. So let's read here about it. It says purpose: maintain stability by counteracting changes from a set point, helping to keep conditions within a normal range. The truth of the matter is most of your homeostasis, if you don't remember what homeostasis is, that's the internal physical and chemical conditions in your body. Most of your homeostasis is actually regulated by negative feedback loops. The crazy thing is, if your body stops having homeostasis, you're probably dead. You need homeostasis. It's really important. And so that's things like you see down here at the bottom: body temperature, blood sugar regulation, so like calcium concentration and all those electrolytes in your body. That's all maintained by negative feedback loop. And it works because your system will detect a change and it reduces the change or reverses the direction to get it back to its original set point. So negative feedback loops are actually quite good. And what they really do is, if, let's say, your body temperature goes up, you start to sweat and it pushes your body temperature back down into the good range. If you get too cold, your body temperature goes down, then you start to shiver. You generate heat with your muscles and your temperature goes back up into the normal range. So a negative feedback loop reverses whatever trend is going on. The other type is called a positive feedback loop. And once again, you might think that positive means good, that it's a good thing you have this. And it is, but that's not what it means. What positive feedback loops mean is that they're going to intensify or enhance whatever stimulus is going on. So let's take a look at the purpose here. Amplify or increase the effect of a stimulus, driving a system further from its starting state until a specific outcome is achieved. Positive feedback loops are often used in a process that needs a definitive conclusion. So two examples we have here are childbirth and blood clotting. Now in childbirth, our ultimate or definitive conclusion is that baby needs to be born. And so when this positive feedback loop starts, it gets stronger and stronger contractions until the female's body pushes the baby out. In blood clotting, it's similar because you've probably had a cut before and you thought, oh man, that thing's bleeding quite a bit, and you're waiting for it to stop bleeding, and it seems to take 30 seconds or a minute, and then it finally quits bleeding. Well, that's because in blood clotting, your platelets or thrombocytes in your blood will stick to the site, and they actually release chemicals to attract more platelets. So it becomes a positive feedback loop. The first couple platelets to get there release a little signal, so more platelets show up. When those new platelets are there, more signals released, so more platelets show up. And so it's kind of a snowball effect. And so both of these things have an ultimate conclusion they want, whether it's childbirth and the baby being born, or blood clotting and stopping the blood flow. So if you compare these two, this little statement at the bottom really summarizes it. I'm not going to lie, I actually got this statement from ChatGPT and I think it did a great job. It says, in summary, negative feedback maintains balance, while positive feedback pushes processes towards completion. What a great one-sentence summary. If you're going to remember one thing from this entire slide, it's that bottom line, because it just does such a good job summing it all up for you. Negative feedback, balance. Positive feedback pushes towards completion. Now on this slide, it seems like there's a lot going on. On the right-hand side, you can see we're going to talk about temperature. So this is going to be a negative feedback discussion. But on the left-hand side, we've got this weird little chart. And the reason we have this is because negative feedback loops, as they maintain homeostasis, or even positive feedback loops, all have these central pieces. So let's look at them. First off, we've got a set point. And a set point is wherever you want to keep your normal range. Remember, your body maintains homeostasis, not equilibrium. If your body's in equilibrium, again, you're probably dead. Your body keeps homeostasis because that's where you need all of these factors to be kept for you to be healthy and living. So for temperature, the set point is about 98.6 degrees. It's actually a range of somewhere between 97 and 99 for most people, so not everyone falls right exactly at 98.6. So that's our set point. Now, the control center is almost always in your brain. And so if you think about your brain, you've got different portions of it. But your brain stem and the bottom part of your brain where the hypothalamus is at, those are part of what I often call the automatic side of your brain. They're the things that keep you breathing, that keep your balance, that let you walk. You know, those kind of automatic things that you don't think about, they just happen on their own. The hypothalamus, like most control centers, is in your brain. And it's the part that's responsible for telling your body what to do. And there's always a control center. There's always something in your brain that's directing what your body needs to do. So our control center here is the hypothalamus on the bottom side of your brain. Now, for temperature, your sensors are these thermoreceptors that are all throughout your body. And you understand that you have thermoreceptors because you've probably grabbed a cold drink or a hot drink or you put something hot in your mouth or you feel the heat off a heater. Those thermoreceptors communicate with your body so you can understand where that temperature is. And you've got them in your skin, your spinal cord, your brain itself. You have thermoreceptors everywhere. So these sensors send information to your hypothalamus. And your hypothalamus is who's going to control what you're doing. And that's where the effectors come in. Effectors are part of your body that are actually going to do something about it. So in the case of temperature, if your temperature happens to go above 98.6, so you get hot, these thermoreceptors will sense that, tell the control center, the hypothalamus, and your hypothalamus will start your body to sweat or do vasodilation. And if you don't know what vasodilation is, it's basically the widening of blood vessels. So if you're somebody, when you get hot from exercise and your cheeks get really red, that's vasodilation. When vasodilation happens, those blood vessels let off more heat, and the sweating actually helps really pull the heat off. So that's the effector pathway to get your temperature back down to 98.6. If you're too cold, these thermoreceptors will send a signal to the control center that's the hypothalamus, and it will send signals out to your body to cause shivering and vasoconstriction or narrowing of the blood vessels. This will generate heat and conserve heat so that it actually helps up your temperature. If you've ever been in like a cold pool or something like that, or maybe you're playing out in a sprinkler in summer and your lips get really blue from being in the water, that's vasoconstriction. More common in little kids because they're smaller, but vasoconstriction happens and it keeps that heat in, and shivering will generate it. That'll help pull your temperature back up. So all of these elements are in any of these feedback loops. Let's take a look at that particular one in a nice flow chart. So here we have the person, normal body. Their temperature falls because they're getting cold. They're going to have thermoreceptors signal to their hypothalamus. Their hypothalamus causes shivering, vasocontraction, heat is retained and generated, and they go back to normal body temperature. If their body temperature rises, maybe they're exercising and they're getting hot, they're going to have a signal sent to the hypothalamus from those thermoreceptors. Blood vessels are going to dilate. They're going to start to sweat, and that sweating will help cool and lose some heat energy to the environment, and that brings their body temperature back to normal. I like these flow charts for the negative feedback loops because what they do is they show us going right back to the original. Well, this flow chart is for positive feedback loops, and it's a little bit different. So you'll notice here we've got baby inside mom's uterus, and baby is in the birthing position, head is down. So this positive feedback loop, you notice it is just one circle. It's just going to rev up. It starts right over here typically. The head of the baby will push against the cervix. And when the head of the baby is pushing on that cervix, nerve impulses will travel to the brain, to the pituitary gland. There's our control center. And the pituitary gland will release oxytocin in the blood. So oxytocin goes to the bloodstream, to the uterus. When that oxytocin gets to the uterus, it stimulates a contraction by the uterus. And so the uterus here is going to push baby down onto the cervix. Well, when the baby's head hits the cervix, it's going to send another nerve impulse. which the pituitary gland interprets to release more oxytocin. And that oxytocin goes right to the uterine, and the uterus is going to contract again. And that causes the baby head to push against the cervix. And then it's going to send a signal. And then the brain stimulates and sends out oxytocin. And the oxytocin travels to the uterus, and the uterus contracts again. And so what happens in this positive feedback loop is that those contractions get closer and closer and closer and closer, and they get stronger and stronger. And that's when the midwife or the OBGYN is going to tell the mother to push. So this is a positive feedback loop, but it still has, senses, and this is our sensory portion, still has a control center, it still has effectors, it still has all those pathways. But instead of, in our previous example, that working in a cycle to maintain balance, now it's working to actually push the baby out. So positive feedback loops are pretty different, but they still work in a way to help us do something. Now we're going to talk about diabetes, which actually falls under a negative feedback loop. I need you to understand that while I'm going to talk about type 1 and type 2 diabetes, there are other disorders of maintaining blood sugar, but these are the most common. Now, you should know most of this already from your diabetes comic book, but basically, type 1 diabetes is caused by an autoimmune disorder. It destroys these insulin-producing beta cells, and so a type 1 diabetic has little to no insulin. This is a childhood onset. There's really nothing they can do about it. It's usually between the ages of 10 and 15 that it shows up. Here's some symptoms for what they're gonna deal with: frequent urination, extreme thirst, fatigue, blurred vision, and really the management requires daily insulin injections. And before we could make artificial insulin, a lot of this insulin came from cows, pigs, horses. And so what they would do is when they would slaughter those animals, they would collect their pancreas and send it off. And nowadays we make artificial insulin, so it works much better. Type 2 diabetes is because of insulin resistance, meaning that the cells don't respond to insulin properly. And so over time, the pancreas can't produce enough insulin, and it actually doesn't matter if it produces insulin because they're not responding to it. Sometimes doctors will treat type 2 diabetes with artificial insulin that's a little bit better, and that can help. But for the most part, type 2 diabetes, they have this resistance. And it really comes up from overstressing the system time and time again. So the risk factors are obesity, lack of physical exercise, and poor diet. There is some family history and some predisposition you can have, but the bottom line is if you're at risk for type 2 diabetes, you really need to work on having some physical exercise. All the research says that, and a healthy diet. And what does that look like? Well, a healthy diet has a lot of non-starchy vegetables and good fruits. And I don't mean fruit juice. It's a misnomer that if you drink fruit juice that it's good as eating the fruit. But the reality of it is that eating the fruit contains the fiber. And the fiber of that fruit helps your body slowly release the sugars out of it. Whereas when you drink the juice, you just get the sugars right away. So what happens in type 2 diabetes is that through the entire life, the person is constantly stressing their probably not that efficient insulin pathway, and eventually the GLUT4 receptor or the glucose transport protein, and they start wearing out, and so they just can't get used that heavily and abused that much. And so in adulthood they develop type 2 diabetes. Here's some of those symptoms. Management really needs to be lifestyle changes. We're talking healthy eating, exercise, and weight loss. And I have known multiple people who have type 2 diabetes who have done this stuff, and they've halted its progression and in some case made it a little bit better. There are some medications and sometimes insulin therapy can help, but if you or someone you know is in risk for type 2 diabetes, these three things right here are so important. Eating healthy, those non-starchy vegetables, whole fruits, make that half of your diet. Try to cut some of the carbs out and not have so many refined carbohydrates or sugars like soda pops. Exercise about 30 to 60 minutes a day so you get some good exercise in, and work on getting your weight down. Those three things are huge. This is a summary chart that kind of does some differences for you, so you can kind of check those out in one little snippet. I really like it, so I put it there. So let's talk about how this pathway is supposed to work. So here you see these little brackets. This is the normal blood range, and that's 70 to 99 milligrams per deciliter for a normal person. Well, you go out and you eat yourself a big lunch and your blood sugar goes up. That's normal. You can see it's gone out of the normal range. But that's okay because you ate, so your blood sugar went up. Your body needs to deal with this process. So what's going to happen is your body will send a signal to the hypothalamus saying, hey, my blood sugar's high. And a signal from the hypothalamus will get sent to the pancreas. But you notice that that doesn't lower your blood sugar because it's part of the signal control center pathway. Now, your pancreas is going to release insulin. That insulin is going to go out into your body, into the bloodstream, and eventually it's going to bind to a receptor called GLUT4. And these receptors signal cells to open up a glucose transport protein to take in blood sugar. But if we watch the steps here, insulin released from the pancreas doesn't lower our blood sugar. Only when insulin effectively binds to GLUT4 on fat, liver, and muscle cells do we actually see those cells lower our blood sugar by pulling in that sugar. So insulin has to function properly, and fat, liver, and muscle cells are who are going to pull in there. Now, this example is kind of a golf example because I like golf. And so let's say you've been playing 9 holes of golf. You're 1 over par, and I would take that any day of the week. In fact, 1 over par after 9 holes would be the best 9 holes I've ever played, because so far to date, the best 9 holes I've ever played is 2 over par. But let's say our caddy forgot our snacks, which is absolutely unforgivable because the food in the clubhouse is too expensive. So we're going to have to play the other 9 holes without eating. Now, most of us think we can't go without eating, and that would just be terrible, but we can. You actually can go without eating for a while. Your body has a system for that. So as your blood sugar drops down out of normal, see it drop out of normal here, there's going to be another signal sent to your hypothalamus. So that signal will get sent to the pancreas. Hey, pancreas, we have low blood sugar. But notice, again, that did not fix our blood sugar. We have to follow the full pathway. So the pancreas gets that signal from the hypothalamus, and the pancreas releases glucagon from alpha cells. Now, glucagon goes into the bloodstream. And notice, once again, just because we have glucagon does not mean that we're going to increase our blood sugar. Glucagon's got to go get to work. So glucagon will bind primarily to liver cells, but it can bind to other cells too. And what it does is it causes them to metabolize and release some glucose into the bloodstream. So glucagon signals for your liver to put some glucose sugar in your bloodstream. And notice, boom, there we go. Our blood sugar goes back to normal. So as you can see, this pathway works much like the other pathway we saw. If we eat food, our hypothalamus gets a signal, we got high blood sugar, sends that to the pancreas, beta cells release insulin, our liver and our fat and our muscle cells take that sugar up, and we go back to normal. If we haven't eaten for a while and our blood sugar falls, well, hypothalamus is going to get a signal, alpha cells in the pancreas are going to release glucagon. Glucagon will travel to the liver. The liver will release some glucose into the bloodstream, getting us back to our normal. Type 1 diabetics have a problem right here. They don't produce insulin, or they produce so little that it doesn't matter. So when they eat something, their blood sugar stays high. And the thing you've got to understand is that high blood sugar damages blood vessels all over your body, and that's the problem. Type 2 diabetics have a problem right here. They can produce insulin, often plenty of it, but the insulin resistance means that their liver, their fat cells, their muscle cells aren't taking that sugar in. And so they end up with high blood sugar still, even though they've got insulin. They'll end up with lots of insulin and lots of blood sugar because it's not going anywhere. And then they fail to get back to homeostasis. And so those are the 2 that we talk about. Are there other problems on the bottom of the pathway? Sure. We could go talk about hypoglycemics, some people whose blood sugar drops and they can't get it back up. But we're not focused on those because they're less common than type 1 and type 2 diabetes. I hope these notes helped you guys, and if you have any more questions, reach out.